So one of the things that originally got me into chiropractic was starting off in my youth was athletics, and I experienced a lot of injuries when I was growing up. And one of the things that I noticed between going to PTs or orthos was sometimes not always having a full understanding of what was going on. And that was a big thing that I try to incorporate now is anytime someone has something that they're experiencing, whether it be an injury, this kind of chronic pain, I want to make sure that I get to not just the root issue, but I want to make sure they have an understanding of what's actually going on. That way they can also be a little more empowered. If they know what's going on, maybe what's causing it, they can also help me have kind of a leg up and even give a better treatment to what they're experiencing. My name is Dr. Chanso Looney. I am a chiropractor. I have multiple specializations. One of the things that I incorporate the most in my treatment is technique, which is called applied kinesiology. It incorporates muscle testing, but also getting to a deeper level and analysis of the human body by incorporating not just some of the structural issues that people experience, but also how nutrition, possibly environmental factors, other issues that could maybe be adding to their problems and their pain. Also, there's a large mental component that we sometimes leave unaddressed that really can wreak havoc on the body, but also increase a lot of the problems that people deal with. Responsibilities we have in life that can actually add to a lot of our structural problems. And so by addressing the mental component, the nutritional component, that gives a better outcome by treating sometimes just the pain and structural problems that we're not always even aware exist. One of the things that I really like when I'm working with someone is getting to truly kind of a deeper level of what maybe caused the problem. A lot of things that bring people in are those initial pains and injuries, but sometimes those are rooted in a lot older, long-standing problems that maybe people experience in their childhood, maybe their teen years. And it's not just treating what the current issue is, but actually going to the original problem where it all started and trying to kind of unravel the issue. By doing that, I seem to notice a better outcomes with, their daily life, maybe getting people back into doing things that they've had to kind of knock out of their life because they just couldn't do it anymore. I love being able to get people back into their hobbies, things they truly enjoy. I've treated many people that have had really significant injuries in their life. They've not only impacted just their work, but really has disrupted their whole way of living. I have become a good friend and family friend now. Originally was a patient, but it sustained such substantial injuries. A lot of people wouldn't even work on him because the risk, the fear of maybe even making something worse left him kind of unattended. People wouldn't want to actually work with him. And by actually just taking time, doing the things that he needed, but also working very gradually and slowly, he's back to working full time. He's able to kind of do his hobbies. He has a whole different, completely outlook on life that he was really concerned that, his life was almost over just because he couldn't do the things that he needed to do, but also couldn't even do the things that he wanted to do. I definitely like to have a conversation with people. Sometimes, we all have different kind of fears of the unknown. And if there are questions that I could answer, maybe things that you're just unsure of, that if chiropractic can help or things that we can address in the office, happy to just have a conversation and just give you my kind of 2 cents on what the issue is. And it may be something that we would make a great pair and we could maybe actually get to the bottom of what's been bothering you.